In the realm of mental health and chronic pain management, Cymbalta stands out as a remarkable medication, offering hope and relief to many. Known scientifically as duloxetine, this pharmaceutical is a multifaceted agent, wielded by healthcare professionals in their ongoing battle against various conditions. My journey into understanding Cymbalta began when a close family member was prescribed it, sparking an insatiable curiosity about its mechanisms, benefits, and potential risks. This exploration led me to delve into medical journals, engage in discussions with healthcare providers, and sift through countless patient testimonials. Cymbalta belongs to a class of medications known as serotonin-norepinephrine reuptake inhibitors, SNRIs. Its primary function is to increase the levels of serotonin and norepinephrine in the brain, neurotransmitters that play key roles in mood regulation and pain perception. The decision to prescribe Cymbalta is not taken lightly. It is arrived at after a careful evaluation of the patient's medical history, current symptoms, and the potential for improvement under its influence. The significance of Cymbalta in the treatment landscape cannot be overstated. For those grappling with certain types of chronic pain, psychological disorders, and other related conditions, it offers a beacon of hope. It is this potential for transformation that drives my interest and fuels my desire to share a comprehensive overview of Cymbalta, from its applications and benefits to its side effects and proper usage. What is Cymbalta used for? Cymbalta's versatility in treating a wide range of conditions is one of its most remarkable attributes. Initially approved by regulatory authorities for the treatment of major depressive disorder, MDD, and generalized anxiety disorder, GAD, its applications have expanded significantly over time. This expansion speaks to the ongoing research and clinical trials that have uncovered its efficacy in addressing other medical challenges. Beyond its mental health applications, Cymbalta has shown considerable effectiveness in managing chronic pain disorders, such as fibromyalgia, diabetic peripheral neuropathic pain, DPNP, and chronic musculoskeletal pain, including chronic osteoarthritis pain and chronic low back pain. These conditions, characterized by persistent and often debilitating pain, can severely impact an individual's quality of life. Cymbalta's ability to modulate pain perception makes it a valuable tool in these cases. Moreover, the use of Cymbalta in treating conditions such as fibromyalgia highlights its unique action on the central nervous system. By influencing neurotransmitter levels, it can alleviate pain and improve mood simultaneously, addressing both the physical and psychological aspects of such conditions. This dual action underscores the medication's significance in the pharmacological arsenal against chronic pain and mental health disorders. Common uses of Cymbalta. Delving deeper into Cymbalta's applications, it's crucial to appreciate the breadth of its utility. For individuals battling major depressive disorder, Cymbalta offers a pathway to reclaiming their mental health. Depression, with its debilitating impact on mood, energy levels, and overall well-being, can be profoundly life-altering. Cymbalta's efficacy in elevating mood and restoring function in individuals with depression is substantiated by numerous clinical trials and patient reports. In the realm of anxiety disorders, generalized anxiety disorder stands as a condition marked by pervasive and excessive worry that disrupts daily living. Cymbalta's role in managing GAD is invaluable, providing patients with a means to achieve a more balanced and less anxious state of mind. The medication's impact on serotonin and norepinephrine levels in the brain is believed to be key in mitigating the symptoms of anxiety. Chronic pain conditions, such as fibromyalgia and diabetic peripheral neuropathic pain, present a complex challenge, often requiring a multifaceted treatment approach. Cymbalta's effectiveness in these areas further exemplifies its versatility. For those suffering from fibromyalgia, characterized by widespread pain, fatigue, and sleep disturbances, Cymbalta can offer significant relief. Similarly, in managing DPNP, a type of nerve damage associated with diabetes, Cymbalta has been shown to reduce pain intensity, enhancing quality of life for many. Benefits of using Cymbalta. The benefits of Cymbalta extend beyond symptom management. They embody the potential for a renewed sense of normalcy and well-being. Patients who have found relief through Cymbalta often report improvements not just in their specific symptoms, but in their overall quality of life. This encompasses enhanced mood, better sleep patterns, and a greater ability to engage in daily activities without the constant burden of pain or anxiety. Cymbalta's dual-action mechanism plays a pivotal role in its effectiveness. By targeting both serotonin and norepinephrine, it addresses a broader spectrum of symptoms than medications focusing on a single neurotransmitter. This comprehensive approach is particularly beneficial for individuals with co-occurring conditions, such as depression and chronic pain, offering a singular treatment solution. Moreover, the benefits of Cymbalta include its potential to improve cognitive function and emotional resilience. Patients often describe a lifting of the fog associated with depression and chronic pain, a sharpening of focus, and an enhanced capacity to cope with stress. These improvements can be transformative, enabling individuals to reclaim their lives and pursue endeavors that were once hindered by their conditions. Potential adverse effects of Cymbalta. While the merits of Cymbalta are substantial, it is incumbent upon us to also consider its potential adverse effects. Like all medications, Cymbalta comes with a spectrum of possible side effects, ranging from mild to severe. Commonly reported side effects include nausea, dry mouth, sleep disturbances, fatigue, and dizziness. These are typically most pronounced during the initial stages of treatment and may diminish over time as the body adjusts to the medication. More serious adverse effects, though less common, can occur. These include increased blood pressure, liver damage, severe skin reactions, and an elevated risk of bleeding, especially when taken in conjunction with certain other medications. It's critical for patients and healthcare providers to maintain open communication and monitor for any adverse reactions throughout the course of treatment. Another significant concern is the risk of developing serotonin syndrome, a potentially life-threatening condition that can arise from excessive serotonin levels in the brain. This underscores the importance of adhering to prescribed dosages and being vigilant about the concurrent use of other medications that affect serotonin levels. The vigilance and proactive management of side effects are paramount in ensuring the safe and effective use of Cymbalta. Proper dosage of Cymbalta. Determining the proper dosage of Cymbalta is a nuanced process, tailored to the individual's specific condition, severity of symptoms, and response to the medication. Dosage typically starts at a lower level and may be adjusted based on efficacy and tolerability. For depression and generalized anxiety disorder, the initial dose may range from 30 to 60 mg once daily, with the potential to adjust based on the therapeutic response and side effects experienced by the patient. In the management of chronic pain conditions, such as fibromyalgia and diabetic neuropathy, the dosage may follow a similar starting point, with adjustments made as needed. It's essential for patients to adhere strictly to the prescribed dosage and schedule, and to consult with their healthcare provider before making any changes. This ensures the medication's effectiveness while minimizing the risk of adverse effects. Regular follow-ups with a healthcare provider are crucial in monitoring the medication's impact and making necessary adjustments. These appointments provide an opportunity to assess the benefits, side effects, and overall progress, ensuring that the treatment aligns with the patient's health goals. The journey to finding the optimal dosage of Cymbalta is a collaborative effort, requiring patience, communication, and a commitment to closely following medical advice. Dangers and precautions of using Cymbalta. The decision to incorporate Cymbalta into a treatment regimen must be approached with caution, taking into account both its potential benefits and risks. One of the foremost precautions relates to individuals with a history of suicidal thoughts or behavior, particularly among younger patients. Cymbalta, like other antidepressants, may increase the risk of suicidal thoughts and behavior in children, adolescents, and young adults during the initial treatment period. It is imperative for patients and their caregivers to be vigilant for any changes in behavior, mood, or thoughts, and to seek immediate medical attention if concerns arise. Patients with pre-existing liver disease or heavy alcohol use should exercise caution when considering Cymbalta, due to the potential for liver damage. Regular monitoring of liver function tests may be recommended to identify any adverse effects on liver health promptly. Additionally, those with a history of mania or bipolar disorder should discuss their medical history thoroughly with their healthcare provider, as Cymbalta may trigger manic episodes in susceptible individuals. Interactions with other medications present another area of concern. Cymbalta can interact with a wide range of medications, including nonsteroidal anti-inflammatory drugs, NSAIDs, blood thinners, and other antidepressants, increasing the risk of bleeding or other serious side effects. Patients should provide their healthcare provider with a complete list of all medications, supplements, and over-the-counter drugs they are taking to avoid potential interactions. Cymbalta versus other antidepressant medications. In comparing Cymbalta with other antidepressant medications, it's important to consider both its unique attributes and its limitations. Cymbalta's dual action mechanism, targeting both serotonin and norepinephrine, distinguishes it from selective serotonin reuptake inhibitors, SNRIs, which primarily focus on serotonin. This broader mechanism of action may offer advantages in treating conditions that involve both mood and pain symptoms, providing a more comprehensive treatment approach. However, the choice of medication is highly individualized, based on the patient's specific condition, medical history, and response to previous treatments. Some patients may respond better to SNRIs, while others may find greater relief with SNRIs like Cymbalta. The side effect profiles of these medications also vary, influencing the choice of treatment. For example, SNRIs may be less likely to cause certain side effects associated with SNRIs, such as increased blood pressure. The decision between Cymbalta and other antidepressants ultimately depends on a careful consideration of the benefits and potential risks, guided by the patient's healthcare provider. It's a decision that requires a thorough evaluation of the individual's needs, preferences, and treatment goals, ensuring the most appropriate and effective treatment plan is pursued. How to safely discontinue Cymbalta. Discontinuing Cymbalta requires a careful and gradual approach to minimize the risk of withdrawal symptoms, which can include dizziness, nausea, headache, irritability, and insomnia. Abruptly stopping the medication can lead to significant discomfort, underscoring the importance of a planned and gradual reduction in dosage under the guidance of a healthcare provider. The process of tapering off Cymbalta typically involves slowly decreasing the dosage over a period of weeks or months, depending on the individual's response and the duration of treatment. This gradual approach helps the body adjust to the lower levels of medication, reducing the intensity of withdrawal symptoms. Patients should follow their healthcare provider's instructions closely and report any concerning symptoms during the tapering process. It's also important for patients to continue engaging in supportive therapies and lifestyle adjustments during and after discontinuing Cymbalta. This may include psychotherapy, exercise, and stress reduction techniques, which can help manage the underlying conditions for which Cymbalta was prescribed. A holistic approach to discontinuation, incorporating both medical guidance and supportive care, is essential for a smooth transition off the medication. Conclusion: is Cymbalta right for you? Determining whether Cymbalta is the right medication involves a comprehensive evaluation of the individual's medical history, symptoms, treatment goals, and potential risks. Cymbalta offers significant benefits for many, providing relief from depression, anxiety, and chronic pain conditions. However, its potential adverse effects and the precautions necessary for its safe use cannot be overlooked. Engaging in an open and honest dialogue with a healthcare provider is the first step in assessing whether Cymbalta is a suitable option. This conversation should include a discussion of the patient's complete medical history, current medications, and concerns about side effects or interactions. Together, the patient and healthcare provider can make an informed decision, weighing the benefits against the potential risks and considering alternative treatments if necessary. For those who embark on treatment with Cymbalta, a commitment to closely monitoring its effects, adhering to the prescribed dosage, and communicating any concerns to their healthcare provider is essential. With careful management and a supportive healthcare team, Cymbalta can be a valuable tool in achieving improved mental health and quality of life. In the intricate landscape of mental health and chronic pain management, the journey to finding the right treatment is deeply personal. Cymbalta, with its unique properties and broad applicability, may offer a path to relief for many. Yet, the decision to pursue treatment with Cymbalta must be made with care, considering the full spectrum of benefits and potential challenges. As we navigate these decisions, the guidance of healthcare professionals, along with our own informed perspectives, will light the way toward optimal health and well-being.